The following is a virtual tour of BeyondLimits.net. Whether you are a researching parent or a potential employee, sit back and enjoy as we navigate you through our informational website. Beyond Limits Physical Therapy Services for St. Louis County School District, where our slogan is Beyond the Classroom Care for Learning with No Limits. Scroll down to find our mission statement, which is to provide skilled professional care utilizing evidence-based practice to improve outcomes in a pediatric population, and to provide creative treatment plans to keep children interested and motivated in their therapy goals. Our vision statement is to provide professional and creative care that is fun and beneficial to children in the school setting. The St. Louis County School District spans over 3 early childhood centers, 10 elementary schools, 5 middle schools, 3 high schools, and 1 alternative high school. It also includes a central office and therapy equipment storage location that is located at the centralmost high school within the district.
Next, we will scroll back to your navigation menu to explore the Beyond Limits delivery of care. Special education services are available to students from 3 to 21 who experience disabilities and require specially designed instruction. Individual programs are developed by an individual education planning team called an IEP, including parents, teachers, administrators, and other specialists when needed. The individual's functional and academic performance is assessed in order to set long-term and short-term goals for the child to achieve during the academic school year. All children in the school are required to have a current health record on file with the school's nurse in order for the therapist to acquire that information. For a student in need of therapy services, a parent's permission is required. These records are safely locked in a file cabinet in the offices of the school which they are attending. The St. Louis County School District has a password-protected IEP system that only allows access to the necessary members of the child's care team. Under the age of 3, children can still qualify for therapy services. However, it is provided through a program known as First Steps. In this program, an individual family service plan is designed for early intervention services. As a child approaches the age of 3, they can prepare to transfer into the school system where they will obtain an IEP and continue getting the services necessary. For children who are not already in the system, it will be necessary for parents, teachers, and other professional staff to recognize that there are concerns regarding a child's gross motor skills and that a referral is necessary. Additionally, children with disabilities are protected under Section 504 of the Rehabilitation Act of 1973. This section designates schools to provide reasonable accommodations to students with disabilities to the degree necessary to provide them with the same degree of access to education that is provided to their non-disabled peers. Children who do not qualify for services under IDEA but who have a disability should receive a plan designed to meet their needs, referred to as a 504 plan. Next, we will scroll down to meet our directors of care here at Beyond Limits. We employ 9 physical therapists, 3 physical therapist assistants, 12 occupational therapists, and 3 certified occupational therapist assistants. Below, you will see our directors of each level of care. Lisa Henderson, our early childhood director, Cory Hermann, our high school director, Jodi, Klott, our middle school director, and Rita, Flynn, and Kelsey, our elementary school co-directors. These future doctors of physical therapy create the core of our Beyond Limits team of care.
Next, we will scroll back to your navigation menu and click to view Beyond Limits policy and procedures. Here you will find the basic policies all employees are required to follow. Employees receive orientation to the company and on-the-job training during their first week of employment to ensure productivity and compliance to company policies. New employees will receive a name badge, documentation login, and training for using documentation. New employees will also undergo education and training on expectations of the company, emergency preparedness, introduction to current employees and therapy team, introduction to school system, billing procedures and rules, bloodborne pathogen, infection control, and proper standard precautions. Additionally, they will be provided with a mentor and observation days, which are optional, with an established employee. Extensive background checks, drug screens, as well as fingerprinting will need to be processed before any therapist begins work. All documentation is completed through an electronic system and can be accessed at each location. If a child moves to a different school within the district, the new therapist can access the previous therapist's notes. The therapists at each school have laptops that are issued from the school district. All medical and personal identifiable information is to be protected and only shared with the patient and guardian, healthcare workers on a need-to-know basis, and the IEP team, unless permission is granted specifically from the patient and guardian. All therapists, therapy assistants, and any employee involved in patient care or billing will abide by HIPAA regulations to protect patient information. Professional dress is expected of employees, including dress slacks with an appropriate shirt with their name badge. Employees are expected to wear closed-toe shoes and may wear athletic shoes if they are clean and in good condition. Jewelry should be kept to a minimum. General requirements for lifting and physical performance of job tasks assessed during biannual competencies directed by supervising physical therapists. Up-to-date vaccines including hepatitis B, meningitis, measles, mumps, and rubella, tetanus or Tdap, chickenpox, and tuberculosis screenings, along with yearly physicals and flu shots, are mandatory before direct contact is made with students. To ensure the safety of our staff and patients, employees are expected to be oriented to the fire safety procedures, emergency evacuation plan, and map of the school they will work with. Therapists must be CPR and AED certified and maintain certification. Therapists will be reimbursed for this certification. Employees involved with patient care, insurance, billing, and/or scheduling are expected to provide professional, friendly care to patients. Employees are expected not to use their phones during work hours, with the exception of break times and utilization of phone applications or processes that are beneficial to treatment. Harassment and discrimination will not be tolerated in any way by our company. If an employee experiences or witnesses harassment, discrimination, inappropriate behavior, or poor patient care, they are expected to file a report of the incident with the manager. Employees can do this anonymously. If employees witness or suspect abuse or neglect of a child, they are mandated to report this to the Department of Social Services. Each physical therapist works autonomously with minimal supervision from administration. The PT coordinator is available for scheduling, assistance, or to address any issues that may arise.
Next, we will scroll to your navigation menu to learn about Beyond Limits communication and safety. Under communication, employees will meet twice a year with the clinic manager to discuss assessment performances, potential for promotion, salary raises, and allow employees to share any ideas, problems, or complaints. In-services will be held bi-monthly to provide continuing education. Therapists and therapy assistants will receive a stipend to be used towards continuing education classes. Staffing meetings will occur monthly, allowing for in-services, exchange of ideas, concerns, and discussions of current status of company. Therapists will meet with the IEP team of their patients weekly. Additionally, parents are encouraged to attend bi-weekly in order to be involved in their child's care, allow for voicing concerns, and to stay involved with home treatment. Therapists encourage family involvement in the care of their child for optimal outcomes. During the parent-therapist meetings, Parents are asked to fill out a survey to give to the therapist an understanding of how the parents view their child's progress while attending therapy services at Beyond Limits. This can help ensure that the child is receiving optimal therapy while they are in school. With safety, maintaining the health of both the patients and employees is very important to this company. For this reason, employees are expected to follow standard precautions as set by the Center of Disease Control for health settings. This includes performing correct hand hygiene before working with the patient, after working with the patient, and if the therapist suspects contact with blood, bodily fluids, or excretions, or wound dressings. Therapists should use personal protective equipment such as gloves, face masks, and glasses when necessary to protect themselves from bodily fluids or infectious agents, and to protect any open wounds of the patient. Disposal of contaminated or hazardous material should be placed in a biohazard container for medical disposal. If an accident or injury to the patient should occur, the therapist is required to fill out an incident report. Guardians of the child should also be notified, as well as the teachers. Therapists and assistants are expected to maintain cleanliness and monitor equipment for safety concerns and maintenance needs. All equipment should be checked monthly for optimal functioning. Safety and maintenance concerns should be reported to the manager so repairs or replacements can occur in a timely manner. All chemicals in therapy areas for cleaning will have a material safety data sheet with a list of active ingredients, instructions for spills, and health and safety information.
Next, we will scroll up to the navigation menu to learn more about opportunities as an employee of Beyond Limits. To provide optimal care for the children in schools, the therapists work hours that coincide with the schools that they are assigned to cover. The general hours are 8:30 to 4 p.m. and can be adjusted on occasion to fit the needs of the children. Work schedules will depend on caseload. Patients will be scheduled through the qualifications of their IEP. Treatments will generally take from 20 to 30 minutes. Evaluations will be scheduled for 60 minutes. Patients will be typically seen one-on-one push-in, which is an in-classroom hallways, playground, or pull-out, which is in the therapy room. Co-treating between PT and OT or speech-language pathology is allowed if the child would benefit. Students will not be seen by a therapist during lunch, recess, or special classes like art, music, or PE. In coordination with the teacher, therapists will make the best effort towards avoiding interruption during important instructional times of class. Therapy services are not offered during school holidays, snow days, or during break. Some employees are part-time while others will be full-time. The school district employs many other staff members involved in the IEP team, including teachers, paraprofessionals, principals, counselors, speech-language pathologists, vision therapists, psychology examiners, secretarial staff, cafeteria staff, maintenance and facility staff, administrative staff, etc. Salaries are on a schedule determined by educational level and years of service. Starting salary for a physical therapist is $66,000. Every 2 years, a physical therapist stays on Beyond Limits staff. He or she will receive a 2% salary bonus added to the previous year's salary. Throughout an employee's service, 14.5% of the salary will be collected yearly towards a pension fund and matched by the school district. Once 30 years has been spent on staff, employees are eligible to collect a retirement pension equal to the individual's final average salary multiplied by 2.5%, multiplied by his or her years of service with the district. This pension equation is also appropriate for employees at 60 years of age with 5 years of service to the district, or when the sum of their age and years of service is equal to or greater than 80. Benefits include sick leave and paid holidays. Doors will be closed when recognizing yearly holidays in accordance with the St. Louis County School District attendance schedule. Paid time off, PTO, is offered based on years of service. For example, new employees will earn 2 weeks per academic year of paid time off, while employees of 15 years of service will earn 4 weeks of paid time off per academic year. Collecting payment without taking time off is also negotiable. Medical, dental, and vision insurance is provided for all full-time employees. Retirement 403B plans, long and short-term disability programs, and non-teacher retirement program are also possibilities for full-time employees. The St. Louis County School District does not have specific CEU requirements other than what is required to maintain each individual licenses. Therapists will be reimbursed for continuing education courses taken based on a set stipend, which is $350 to $450 per year.
Next, we will scroll up to your navigation menu to grasp a better understanding of the payer systems involved in the business. Throughout the school system, physical therapy must be provided free of charge for children who are eligible for services. Under Part B of the Individuals with Disabilities Education Act, children who are within ages 3 to 21 have access to a free, appropriate public education, and this includes special education and any other services required to meet the child's needs. Physical therapy in the school setting revolves around ensuring that a child has access to his or her educational environment. This includes traveling throughout various parts of the school, such as hallways, classrooms, the cafeteria, and restrooms, and also safely getting on and off the bus and participating in the classroom. Once teachers or parents determine that there is a need, an IEP referral is submitted and the process is begun. Then a physical therapist who is employed within the school district will evaluate the child in order to determine their eligibility for physical therapy services. In order to receive physical therapy and for reimbursement of services, a physician referral will be necessary. In the state of Missouri, payment for services requested on the IEP are fulfilled by Medicaid, also referred to as Missouri Health Net. In Missouri, the payment is based off of the federal financial participation rate, which is 60%. The physical therapy services will be reimbursed on a fee-for-service basis. Additionally, the school district will be responsible for the remainder of the payment, or if Medicaid does not reimburse in particular circumstances. Currently, physical therapists do not provide screening for the general population of children in the school system. Services through the district are exclusively for the children with IEP referrals. Risk management. We have legal issues that can arise with non-compliance of the IEP. When a parent believes other members of the team are not following the proposed plan, or if they feel that their child's needs are not being addressed, he or she could file due process and begin the process of suing the school district. IEP team meetings are scheduled weekly in order to keep communication open between the family expectations and the administration execution. Another legal risk is present if a student is injured during therapy. A safety protocol is set in place to provide guidelines for the safest environment and techniques used throughout a therapy session. In any case, the district will provide legal representation for the therapist. Some physical therapists can choose to obtain additional malpractice insurance for personal coverage. For more information about resources utilized, please visit the Our Sources page. And thank you for visiting BeyondLimits.net.